That's a great point. Let's just talk a little bit about, diagnosis of diabetes. How do we diagnose? So, for the lay
Sure.
folks, the diabetes is high sugar. So, at what level the sugar diabetes, we call it diabetes. So, on this slide, you can see more than 126 fasting, or if you do the 2 hour postprandial, then it should be more than 200, or random sugar more than 200. And the third aspect is the A1C greater than 6.5. Anything else you want to add to the diagnosis of diabetes?
I think no. I think that's a good summary of the whole thing. I think obviously if there is less than that, then you call it pre-diabetes, right? Between 100 to the 126 mark is pre-diabetes. That's when majority of the patients in the community might find themselves. So, and then if it is 140 to 200 after food, then that's also considered impaired glucose tolerance or pre-diabetes. We combine all of things and call it pre-diabetes.
That's a good point. And let's quickly look at different organs. It's a busy slide. So, do you want to just give a quick synopsis? What does it cover?
Sure. I think without spending too much time on this, like you said, we can speak for an hour on this slide, but but I think it's just I just wanted to open up this idea of for everybody that diabetes is not just the disease of the pancreas or the liver itself. It is now we know that multiple organs are involved in the pathophysiology, including the kidney. We understand that there is also involvement of the neurotransmitters in the brain, which do not make us feel full, and we are hungry despite our sugars being high, our insulin levels are high, but we still don't feel full. And we find that there is some neurotransmitter dysfunction, there is increased glucagon secretion in the liver, and there is increased lipolysis, the fat breakdown, which leads to insulin resistance. And also there is this incretin, which is a fascinating concept which we have figured out over the past few years, is released from the gut. So those hormones can play a crucial role in increasing the insulin after we eat. And if that is lacking, then we can get into trouble. We'll talk a little bit about the next few slides about some of the new drugs which can accommodate all these different mechanisms.
Right. So, it's a multi organ disease, not just pancreas, as you just pointed out. So, that increases the targets as well to improve the diabetes, which has exploded in last 10 years. Thank God for that.
Absolutely, yeah.
And some of those drugs are magical, like the GLP-1 agonist. We're going to talk a little bit more. It has helped
Absolutely.
the patient lose weight, and so they work on different aspects of the diabetes. So it's like cancer treatment now, Venkat, where you have multi-target approach to control your sugars, not just like in olden days we just had insulin, and then this the sulfonylureas. Now we have multi-organ targets to work with.
Absolutely. Absolutely. And we'll dwell into some of those in the next few
Right,
slides.
right.